Hello, this is Dr. Scott Warner, and I'm the Municipal Health Officer for the City of Cullman. The opinions and information I'm sharing with you is based on factual information from reliable scientific sources and may or may not represent those of the hospital administration. Let me answer several frequently asked questions. As I have said in a previous video, it is now recommended that persons indoors, whether vaccinated or not, should wear a mask. And so that is something that people will use to question the effectiveness of the vaccine. Well, if I have to wear a mask anyway, what's the point of getting the vaccine? Again, that is a misunderstanding of what masks are about. So does that indicate that the vaccine is not protective? Not at all. In fact, your risk of being hospitalized or dying being vaccinated is extremely low. Your chances of getting infected are low, but not zero. And that's the point of adding the recommendation that indoors, if you are vaccinated in a high-risk area, you wear a mask. The mask is a simple surgical mask or a face mask. This has been a misconception since the beginning of the pandemic. This type of mask is not to protect me, it is to protect you. So if you see me wearing a mask like this, it means that I care about you. In other words, even though I am vaccinated, if for some reason I happen to get infected with the Delta variant of COVID, there is a chance I could spread it to you. So by wearing this mask, I am protecting you, whether you're vaccinated or not, from getting it. In addition, the vaccine is not perfect, and no vaccine is. But 99% of current cases of hospitalization or death are in those who are unvaccinated. Now, if for some reason I want to protect myself, I'm going to wear an N95 mask. So wearing this does not mean the vaccine is not working. It means you may not be protected, so I'm going to wear this to protect you. This is to protect me. So again, making that clear will show the audience that it is not a failure of the vaccine. Like anything else, a vaccine is only as good as the person who receives it. We do know that older Americans, people with underlying health conditions, sometimes do not get a full response to this or any other vaccine. And that's what we're seeing, is that in the few breakthrough cases that are happening, most of those are in people who perhaps don't have the perfect immune system. So in other words, you should be cautious about your outdoors around you and the people who you're with, whether you're vaccinated or not, because of that concern. Another question, are vaccines free? Yes, absolutely. The government has paid for everyone to get a vaccine, so there are no barriers. Whether you're insured or uninsured, whether you're a United States citizen or not here legally, you still are eligible to get the vaccine. As long as the vaccine is available, that will protect us. Everyone needs to get a vaccine as soon as possible. I can tell you from personal experience, even this week, I've had 2 persons who I know of who are hospitalized who should have received the vaccine. They have multiple risk factors for severe disease, such as diabetes and others, including age, but they did not get the vaccine. Of course, they are now begging to receive the vaccine, but it is unfortunately too late, and we are trying to take care of them the best we can, but I am concerned about one or both of these actually surviving to be discharged from the hospital. Certainly, if they had it to do over again, and if they could be here, they did give me permission to say to you, please get the vaccine. Their failure to do so has become ever so clear to them and to their families, the severity of the disease that we're talking about here. If children do not frequently have severe illness, why do they need to get the vaccine? Well, again, a COVID vaccine in people 12 and over is recommended. It can prevent the child from getting the disease, but more importantly, from spreading the disease. We know that the spreaders now are predominantly people who are in their younger years, 20s and early 30s. So they may not get as sick, although they certainly can. They may, however, spread it to others who then do become sick or potentially die. So as long as it can spread people will become infected and people will become sick and die. So everyone 12 and over really should be vaccinated. How did the FDA determine the safety and effectiveness of the Pfizer vaccine in children 12 through 15? Again, there was over 2,000 children between the age of 12 and 15 in the study group, and the other half got a harmless placebo, which is basically just water, and it did show a dramatic improvement. There was 0 cases of COVID in the children who got the Pfizer vaccine, and there were 16 cases of COVID in those who did not, suggesting 100% effectiveness of the COVID vaccine in that group, and that those people continued to be monitored, and some are even enrolled in the booster trial. Next question I commonly get is, what about the vaccine boosters? Is a vaccine booster currently recommended? Vaccine booster trials are currently ongoing. Again, the current vaccines were all formulated against the original, or what we would now call the alpha strain of COVID-19. It is being studied whether a booster that contains a modification for the Delta variant and others would be helpful. That is ongoing, and that information will be coming out soon. I suspect that at least people who have a poor immune system, such as those who are over a certain age, people who are potentially on immunosuppressing medications because of some type of autoimmune disease or a transplant, people who have diabetes and other things will likely be recommended to have a booster. Whether everyone will be recommended to have a booster is to be determined. So we will keep you updated on that, but currently boosters are not available but are being studied to be released if needed. Next question commonly received, in fact I received this question just moments ago before I came in. Can COVID-19 vaccine give you COVID-19? The answer to that is no. Unlike some other vaccines in the past for different illnesses, such as swine flu and things like that, there is no germ in the current vaccines. Therefore, you cannot get infected with the virus from the vaccine. That's one of the beauties of the current vaccine technology, is that we are not taking live viruses and injecting them into you. That is old technology, and one of the reasons why the current vaccine is considered to be safe and effective. In fact, some of the best safety of any vaccine that's currently available. So what are the potential side effects of the COVID vaccine? Again, I'm not going to say that the vaccines are perfect because nothing is, but when you weigh it against the illness that we're fighting, you will see a huge difference. Yes, you can have pain, redness, and swelling at the site where the shot was given. You potentially could have fever for a short period of time or even a day or two, fatigue, headache, muscle aches, chills. Your joints could potentially be tender. You may even have some nausea, vomiting, feel sick, or you may even have some swollen lymph nodes. These are the most common side effects if you're going to get one. But again, these are typically very short-lived, usually a day or two at the most. You will be monitored after getting your vaccine for a minimum of 15 minutes or up to 30 minutes if you have a history of severe allergic reactions because of previous exposures. For transparency, let me tell you the negative aspects of the vaccine. Again, just to be completely honest, there are a few side effects of the vaccine in rare cases, and these are the things that we know as far as what we would call serious adverse events of interest. One is anaphylaxis. This is one of the first things that we heard. These are occurring in small numbers, 2 to 5 people per million vaccines given. These people typically already have a severe allergic reaction or a prior history of anaphylaxis to other things, such as foods or previous vaccines. And so these people are monitored. There's equipment and medications to treat these. And the majority of the time that's short-lived and not life-threatening. And there's no significant increase in deaths from the vaccine because of this. And the people who have this may or may not get a vaccine. That would be in consultation with your doctor. If you are experiencing an allergic reaction to the vaccine. Again, rare, mostly associated with PEG, which is polyethylene glycol. If you are known to be allergic to that, you probably should avoid the vaccine or speak with your physician. But if you didn't know you were allergic to that, then you might experience things like hives, swelling of your lips and tongues, or wheezing. These are signs of an allergic reaction that need to be addressed immediately, and so don't delay if that is the case. The second serious adverse event reaction of concern is what is called thrombosis with thrombocytopenia, or TTS. This is basically a blood clotting issue that you may have heard of. Again, this is typically associated only with the Janssen & Janssen or J&J vaccine. That is not a mRNA vaccine. That is a different type of technology and does seem to be associated with this. This is the single-dose vaccine, by the way. Again, nearly all of those affected were women between the ages of 18 and 49, and we know that women in childbearing age do have a higher propensity to develop clots anyway, and so that seems to be one of the common denominators. And how often does it occur? Extremely rare, but even so, it is concerning, and no doubt. About 7 per 1 million doses of vaccine in women in this age group. For women over 50 and men of all ages, the disorder is very, very rare. If there are concerns about this, what possible symptoms would somebody develop? Again, the things that are concerning for this potential syndrome are shortness of breath, persistent stomach pain, blurred vision, or persistent headache. Again, you may have a brief headache after the vaccine, but if it is persistent, you need to seek medical attention promptly. Chest pain, leg swelling, or tiny bruises or little red spots on your skin would be something that would be notable. There is treatment available for this now, so that in the majority of cases, again, rare, but if it did occur, it can be treated and prevent any serious. What about another potential adverse event of serious concern is what we would call the Guillain-Barré syndrome. Again, this is almost predominantly seen in the J&J or the single-dose vaccine. Again, that is not an mRNA vaccine. It's a different technology that uses adenovirus, which is another virus to bring the material into the body for immune response. Again, this is a weakness, a muscle weakness that is related to a nerve paralysis. Again, weakness or tingling in the arms or legs, difficulty walking, difficulty with speaking, chewing, swallowing, or facial movements, double vision, and trouble controlling one's bladder or bowel. Again, after the J&J vaccine, there were 13 million J&J vaccines given, and only 137 preliminary reports of Guillain-Barré. And so we knew that Guillain-Barré occurs just commonly in the community anyway, from different viruses and things like that. So those are concerning, but it is not typically seen with the 2-dose mRNA vaccines. Last, let me talk about a few other adverse events of concern. These are what we call myocarditis and pericarditis, which is inflammation of the heart muscle or the lining of the heart. Again, these are also rare, but they are reported in men, particularly age 16 and older, would develop this, and the inflammation is concerning. It seems that the myocarditis is typically in younger patients and usually after the second dose. The pericarditis tends to be in older patients and occurs equally with the first or second dose. As of just a few days ago, there were just barely over 1,000 reports of either one of these problems in people who received the vaccine. This typically is occurring 2 to 3 weeks after the first or second dose. Some of the people did go ahead and receive the second dose anyway, and it did not cause any worsening of the problem, and there are no deaths in people who had pericarditis or myocarditis. So although a concerning issue. It tends to be transient. The symptoms that may occur are chest pain, shortness of breath, and feeling of fluttering or fast beating in your chest. If for some reason that is something you are experiencing, please see your doctor. Typical time frame again is 2 to 3 weeks after the vaccine dose, and it's usually treated with anti-inflammatory medicine and resolves on its own. Thank you for your attention to these information, and I welcome additional questions.